Uterine fibroids are non-cancerous tumor in uterus or around the uterus, and we can't say these are rare. Usually, they can be detected on ultrasound basis. Sometimes females are not having any problem, but if they are going for ultrasound, they can be incidental findings. So, if fibroids are small in size, then nothing to be worried. But if they are large in size, there can be requirement of regular follow and treatment also. Typical symptoms of uterine fibroids are there can be heavy bleeding during periods, there can be excessive pain, dysmenorrhea during periods, and there can be difficulty in conception. If fibroids are very large in size, there can be heaviness in the lower abdominal area. These are the common complaints that women are presenting who are having uterine fibroids. Uterine fibroids, although exact origin is unknown, exact etiology is unknown, but female are having estrogen and progesterone in their body, and these hormones can be associated with development of uterine fibroids. It can be genetic based. If female is having genetic history, family history of uterine fibroids, if her mother is grandmother are having uterine fibroids, then there can be more possibility of developing uterine fibroids. Secondly, delayed marriage. In delayed marriage, if suppose a female is getting married at the age of 32, after that she will plan for conception, then there can be more possibility of developing uterine fibroids. And third thing is obesity and hormonal imbalance. They can be associated with uterine fibroids. Uterine fibroids are common. In 25% to 30% female, we can diagnose uterine fibroids, but cancer is rare, right? And in cancer, uterine fibroids, they can be kept under observations, but in cancer, definitely we would have to plan for surgery. Uterine fibroids can decrease the fertility of a female. Sometimes, if fibroids are very large in size, they can distort the uterine cavity. And due to distortion of uterine cavity, there can be difficulty in implantation of fertilized egg inside the womb. So, there can be increased risk of abortion. Or initially, I would like to say there can be difficulty in conception. Suppose a female conceives, there can be more chances of abortion or preterm delivery if female is having large uterine fibroids. Uterine fibroids can be diagnosed with the help of ultrasound. If there are multiple fibroids, very large in size, then before planning for surgery, we can advise for MRI also. MRI is more confirmatory as compared to the ultrasound to assess the size of fibroid. There are two treatment options for uterine fibroids. First thing I would like to say, if fibroids are very small in size, then nothing to be worried about that. If they are less than 3 centimeters, don't worry, only regular follow-up is needed. Female are advised to get ultrasound scan done after 6 months or 1 year. If size remains same, then don't worry. But if size increases, suppose at 6-month interval, size becomes double in the measurements, then treatment plan is decided. In treatment plan, if female is less than 45 years old or less than 40 years of age group, then only myomectomy can be done. In myomectomy, only fibroids are removed and uterus are preserved. But if female is having more than 45 years of age group, her family is complete, and there are multiple uterine fibroids, then we can plan for hysterectomy also. In hysterectomy, uterus is also removed along with the fibroids. In medical management, we can think about uterine artery embolization. We can think about some medical drugs also, GnRH analog, but these are not so much successful. So, confirmatory treatment is surgery only, like myomectomy or hysterectomy. There can be heavy bleeding There can be difficulty in conception, and although chances are very, very few, but yes, there can be 0.5% chances of developing uterine fibroid into cancer like sarcoma. Sometimes we are getting patient at the clinic with the small fibroids. So first thing I would like to say, nothing to be worried about that, as they are non-cancerous. Secondly, if fibroids are small in size, then you can be kept under observation without any surgeries or any medical management. Nothing is required for that. And third thing, if you are near to menopause and fibroid are small in size, then don't worry. Once you will attain your menopause, fibroid size definitely will decrease in size. Uterine fibroids can't be prevented, but yes, if there is healthy lifestyle, if someone is taking OC pills, oral contraceptive pills can increase the size of fibroids, then we can advise a female to stop the oral contraceptive pills to control the size of fibroids. And if there is healthy lifestyle, there is no hormonal imbalance, then it's okay. And if fibroids are small in size, we can monitor them as after menopause, their size decreases. So nothing to be worried about that. But yes, if fibroids are large in size, obviously we would have to plan for surgery.